So I'm an advisor for Pure Encapsulations, and I have no other conflicts of interest to disclose. So tonight we're going to be talking about a number of diets that are recommended in the functional medicine space. So the autoimmune paleo diet, paleo low carb, ketogenic Mediterranean, FODMAPs, which was developed here in Australia, as well as vegetarian and vegan. Now, if you did read the abstract, you would see that I mentioned carnivore. I actually didn't have paleo in there, but after speaking to my colleagues, not many practitioners are really recommending carnivore, though I'm happy to open up the discussion at the end and talk about all the different diets if you've got any questions. But in the interest of time, I put the paleo in there because I didn't have that in the abstract, and that's often more of a question from our patients, or more likely what we would advise as practitioners in general. So just to start and think about really the reasons why we eat. So as practitioners, we focus so much on health. I know I do. And we're thinking about the macronutrients and the micronutrients. And of course, I'm going to touch on those tonight. But the reality is eating is so much more than just fueling our body, just giving us macronutrients and micronutrients. Food is pleasure. Food is very important when it comes to cultural celebrations, social gatherings. And I think we need to remember this, particularly when we think about holistic health, in the fact that, the social connection, the pleasure, the connecting with loved ones, with families, and celebrating is so important really for our overall health and well-being, for longevity. We know when it comes to healthy aging, reducing risk of age-related cognitive decline and conditions, a lot of that has to do with socializing and just getting enjoyment out of life. And there's no doubt that food can offer a lot of pleasure, and we want to be careful not to remove foods that people might really enjoy. Of course, we want them to be well and healthy, but remembering that food has so many aspects to it. So why do we need to eat? These are the things that we all know as practitioners: getting our macronutrients. So carbohydrates, particularly carbohydrates that are really rich in fiber. Fiber is so important for gut health, for the microbiome. Our protein intake, essential amino acids that we don't make in our body, we have to get from the diet. And then obviously fatty acids. And again, there are essential fatty acids that we need to get from the diet. On top of all the macros, we have our micronutrients, and there are so many different vitamins and minerals. And really, to achieve all of these and really gain that optimal health, or help our patients get well if they've got a chronic condition or use food as medicine, generally we want to have a really wide variety of foods so that we are getting all of these micronutrients and we don't have any nutrient deficiencies. Because we know if we have nutrient deficiencies, that increases risk of big things: cardiovascular disease, diabetes, autoimmune conditions. It affects our immune system, mood, energy, etc. So we definitely don't want any nutrient deficiencies. So when it comes to diets, most people don't really want to be on a diet, but the reality is, as practitioners, we tend to give diets because we know that food is medicine. Food gives us what we need, not just our macros and micros, but there is so much more in food. And I've touched on it in previous talks that I've done, talking about the epigenetic components. Our cruciferous vegetables that have these, glucosinolates that, can activate the microbiome to metabolize sulforaphane that then turns on detox enzymes. I mean, our food literally talks to our DNA. But the problem is, once we have a diet and we think that we can't have something and we're denying ourselves, we often might crave it more. Or what tends to happen is people will commit to a diet for a short amount of time. So they're all on, I can do that. And, guns blazing for, a month or 2 or 3 months, they get some results, but then they just go back to old habits. And really what we want to do is set people up with not a diet, but just a way of eating that works for them, that works for their lifestyle, that gives them all the nutrients they need to be well. So the first diet I want to speak about is the autoimmune paleo diet, the AIP diet. So this is really popular for people that have autoimmune disease, but not just autoimmune conditions, even just subclinical thyroid or chronic conditions. chronic fatigue, serious gastrointestinal issues, IBS. And for those of you who've done training with IFM, the Institute for Functional Medicine, I know they've come out to the Philippines. I was there for that training. They did, it was about 5 years ago, I did the training. They say that an elimination diet is really the gold standard for treating gastrointestinal disorders. I don't know if anything has changed there in the last 5 years, but the AOP diet is really an elimination diet. So it's a short-term diet. The results are expected within 30 to 90 days, and it requires discipline and support. There is some evidence that it can help with inflammatory bowel disease. And there was a particular study at the Cleveland Clinic for Functional Medicine showing that there was some improvement in women with Hashimoto's. And I've got this paper here. I do a lot with thyroid conditions. So I tend to see patients in the fertility space, thyroid, because I've had thyroid issues, and then a lot with women's health, hormones, and healthy aging. So I particularly sort of gravitated towards this around the Hashimoto's. But what it showed is that an online diet and lifestyle program based on the autoimmune protocol, so the AIP, can significantly improve symptoms. So they did have a questionnaire, and it showed that the 10 weeks of doing the AIP diet, there was an improvement in quality of life and symptoms. However, there was no statistically significant change noticed in thyroid function or thyroid antibodies. So in this case, there wasn't an improvement in the autoimmune component. There was a slight change with CRP and white blood count, so possibly reducing inflammation, and they suggest that larger studies are needed. If you can see down the bottom, there was actually 16 women that completed this thoroughly. In reality, we would need a much larger study to get some reliable data. So when we think about the autoimmune paleo diet, the AIP diet, it includes meat, seafood, lots of veggies, except nightshades, fruit, and healthy fats. And depending on the practitioner, some practitioners will actually take out all fruit or some types of fruit and not include all of it. And then what will happen is after a period of time, then there's the reintroduction phase where you'll reintroduce foods such as, nuts or seeds or eggs or legumes and see how the person reacts to those. The issue with not just the autoimmune paleo diet, but elimination diets in general is that what I see is people that actually haven't done them properly. And I'm not sure if those of you listening do a lot of elimination diets, but sometimes people tend not to come back to the practitioner, or they might get some success. Some of their symptoms improve once they've removed a lot of these sort of inflammatory foods, and they're either scared to add foods back in, or they do start the reintroduction and then they start reacting, so they stop doing that. And then over time, they become very, very limited with their foods. So they're not getting a lot of the nutrients they need. They also have big shifts in their microbiome. And I have worked with a number of patients now that have seen me years after being on elimination diet, and they can only tolerate 5 foods. It might be lamb, pumpkin, coconut oil, and something else. And for years, they've had this limited diet. So I'm very, very cautious of elimination diets because we want people to be eating as many foods as possible. And if they are something that we are doing, and I do, believe me, tell people to trial getting off gluten and dairy and definitely sugar, things like that. But if we are going to be doing diets like this where we're removing, food groups, and you're getting rid of, all the legumes and, nuts and eggs and, whole grains and things like that, you need to have some kind of package or some kind of agreement with that patient that they're going to come back and see you, and that they can have that support in the reintroduction phase so that it doesn't turn into a more serious condition. So with the paleo diet, this is a pattern of eating based on the Paleolithic ancestors, apparently. We don't completely know, but it's thought that it's mainly, veggies and meat, nuts, seeds and berries, low in grains, and obviously none of the processed and packaged food that weren't around in those times. So there are many versions of the paleo diet. Different practitioners prescribe different things, but at the end, really, it's about fresh food, unprocessed, removing added sugars and salts, and it is high in vitamins and minerals. Generally, low GI carbs are recommended, no manufactured fats or fast food. And it's thought that this can help overcome, possibly, treat a lot of chronic conditions that may be linked to the Western diet. And when we say the Western diet, that could be the SAD diet. So we're looking at, the American diet, Australian diet. But even when we're thinking about Asia, even though you have a different diet, the reality is, that Western diet has really infiltrated to so many countries, processed foods, high sugars, processed fats. So to get a visual of the paleo plate, we can see sort of down the bottom, sort of the meat and the protein, the top right, the veggies, and then our sort of fats, nuts, and seeds. So almost a third, not completely, but you'll see sort of the other plates as we go through, and you can see a stark contrast between the different diets. So with the ketogenic diet, this is a very low carbohydrate diet that delivers a moderate amount of high quality protein and a high amount of dietary fat. So it's really important to have these high quality fats. There's a moderate amount of meat and fish, low veggies. Most of the time, no dairy, but sometimes there is dairy depending on the diet. And the classic ketogenic diet has a 4-to-1 ratio of fat to protein and carbs. So by reducing the carbohydrates, this promotes the breakdown of fat. We then get ketones and people go into a state of ketosis. And these ketones are what fuel our brain and our body. So they are the energy source. So this particular talk is really focused on sort of overall diet for reducing risk of chronic disease, helping our patients that have, metabolic issues, inflammatory issues, not necessarily seizures as a whole, but I'm going to mention that here because you can't not mention seizures when we're thinking about the ketogenic diet, because with the others, we're not really thinking about treating seizures, but there is evidence that the ketogenic diet can help with reducing seizures. So it's thought that approximately 50% of children that go onto a ketogenic diet will have a reduction in seizures by about half, and approximately 30% of children on a keto diet will have a reduction in seizures by up to 90%. And when it comes to epilepsy, this particular diet can actually completely stop seizures in approximately 30% of epilepsy patients. So I'm currently seeing a toddler who has Dravet syndrome. So I can see people just getting there. Just letting people in. I have a toddler who has a rare genetic condition, and it's a form of epilepsy and has a lot of seizures. And she went on a lot of medications. It wasn't working, and really had to push for it, but was working with the dietitian at the hospital now on a ketogenic diet. And she did this before coming to see me. And the ketogenic diet in this particular case has actually been better than any of the medications that little girl was on. So definitely I haven't worked with anyone with Dravet syndrome before. It's a very sort of sad story. I work more in the nutrigenomics and epigenetics, not clinical genetic space. But that is definitely an example where the ketogenic diet has helped her. So looking at the ketogenic diet, very different to paleo. We can see here the meat, very minimal for carbs. And then we can see really it's majority with these sort of fats. So looking at nuts and seeds, oils, healthy fats, things like that. So when you are on these particular diets, if you're thinking about a ketogenic diet or, any diet an elimination diet where you're removing food groups, the reality is you're removing you're limiting the nutrients that we're getting into the body. So if you are going to be implementing these diets because someone really is having, terrible gut symptoms, they've got food sensitivities, they don't know what it is, you think you need to trial elimination diet. In certain circumstances, you might be thinking about a ketogenic diet. You do want to be thinking about adding in at least a multivitamin, minerals in some cases, vitamin C. So if someone is having a carnivore diet or a ketogenic diet and they're not having all of these fresh foods, because think vitamin C is in our fresh vegetables, fresh fruits, they're likely, humans don't make vitamin C, so we need to get that from the diet. It is found in liver, and you'll find that a lot of people on a ketogenic or carnivore diet, even if they're not having liver, they might have liver supplements. But I'd still question whether they're getting enough vitamin C. And as you all know, I've done a few talks for you now. When it comes to vitamin C, liposomal C is definitely my favorite, but it doesn't have to be liposomal. There's obviously other forms, powdered forms, capsules, things like that. In addition to, minerals or a multivitamin and vitamin C, thinking about prebiotics and probiotics. So we know that fiber feeds the gut microbiome, the bacteria, the microbes in the gut. So by limiting the diet, we are going to have some die-off. And in some cases, you might want that. There might be potentially pathogenic, bacteria or overgrowth of certain bacteria. And by changing the diet, you get a big shift in the microbiome. But what we really want over time is a very diverse and abundant microbiome with lots of different species in there. So giving prebiotics to help feed those bugs and probiotics to help repopulate with beneficial microbes can be really important, particularly in diets where you're not getting a lot of the fruits and veggies with the phytonutrients, with the fiber that the microbes like. So the Mediterranean diet, there's no doubt that this has the most evidence. Most of the research has been done, and it doesn't mean that it's the best diet at all. It's just that there has been a lot of research in this particular area. So we know that with the Mediterranean diet, it's predominantly plant-based. It's not a vegetarian diet though, but it's more so seafood, oily fish, some white meat, and there is red meat, but it's quite rare depending where you read. Most of the time they say red meat might only be, once to twice a month. So if you've come to my talks in the past, you might remember this slide. There are so many research studies looking at the Mediterranean diet in relation to metabolic health, diabetes, cardiovascular disease, Alzheimer's, dementia. But I like this one, as a geneticist, as someone that loves knowing what's going on in the cells and the DNA, this is a really nice sort of diagram where we're looking at the constitution, so the factors that are in these foods that are influencing our cellular and genetic health. So this is in relation to aging, though we know that aging is the #1 cause of age-related and chronic conditions. We know that, with the Mediterranean diet, things like olive oil, it's anti-inflammatory, reduces oxidative stress, resveratrol in red wine, again, omega-3s, oily fish, all these veggies, all the different colors getting the phytonutrients. This can improve genomic instability. So DNA damage is something that occurs in cancers, fertility complications, and basically we want our DNA to be replicating so that we can heal, we can repair, we can age well. And the Mediterranean diet has a number of compounds that have been shown to reduce DNA damage and oxidative stress, can potentially help with telomeres, epigenetics, which we've talked about, sulforaphane, certain foods, blueberries, turmeric, all of these things that literally talk to our DNA, as well as supporting the mitochondria, energy, things like that. But it doesn't have to be just a Mediterranean diet. The reality is if you are eating, good quality oils and you're having seafood with the omega-3s, lots of veggies, and even thinking about an Asian diet that has a lot more, say, seaweed, fermented foods, sea vegetables, this can be really beneficial as well. So when it comes to Hashimoto's, there was a study that showed that higher meat intake was associated with increased risk for thyroid autoimmunity, while the Mediterranean diet was protective. And it showed that in Hashimoto subjects, oxidative stress was higher. And this is in those that were having a higher meat intake. So it suggested that there was a protective effect of low intake of animal foods towards thyroid autoimmunity and a positive influence on redox balance. So basically reducing oxidative stress, reducing DNA damage with the Mediterranean diet. I think it's important to eat, in my opinion, animal foods. You get some nutrients in animal foods that you don't in plant foods. I think it's about getting as many nutrients as possible. But I think the overarching evidence, when you look at everything, over the years, from a chronic health condition, from a healthy aging, it does seem that a lower meat diet is more beneficial. So when it comes to vegetarian and vegan diets, they might eat dairy and eggs, while vegans do not eat any animal foods. So the Vegan Society defines veganism as a way of life that attempts to exclude all forms of animal exploitation and cruelty as much as possible. The thing with vegans and vegetarians, they have to be meticulous, really, about eating really healthy foods and combining certain, grains and legumes and vegetables and things like that to get complete protein. So it's not just about the micronutrients, but really important for the macronutrients as well. We often think about, B12 straight away, or iron, when it comes to vegan and vegetarians, but thinking about other minerals, calcium as well. And as I said, the protein. So I mentioned that I do recommend, I eat meat, and I do recommend people eat meat. But when it comes to vegans, I definitely respect their way of life, their way of thinking. I think as humans, not only exploiting animals, we exploit nature, our resources. I think we need to change the way that we manufacture foods, the way we treat the planet. So I definitely respect vegans, but I think they are limiting the nutrients that they're getting in. If we're thinking about, cellular health, genetic health, overall, reducing risk of disease, definitely want to be thinking about supplementing, unless they have the ability to just have an abundance of food around them and know how to pair and match foods together, as I said. So you can see here with the vegan plate, you really need to be eating a lot of different foods to get the nutrients that you need. And then you still want to be thinking about some key supplements such as B12, possibly vitamin D, though most of the vitamin D is coming from the sun, not from foods anyway. So FODMAPs, I'm not sure if FODMAPs is popular over in Hong Kong or the Philippines. It was developed here in Australia, in Melbourne at Monash University. It's definitely quite popular here, and I know that it has become quite global. It's also big now in the UK and the US. But basically, FODMAPs describes fermentable oligosaccharides, disaccharides, monosaccharides, and polyols. So these are short-chain carbohydrates that are prone to absorb water and ferment in the colon. And by reducing these FODMAPs, these particular short-chain carbohydrates, this can be used to manage IBS and gut symptoms. So the way the FODMAP diet goes is, for the first 2 to 6 weeks, you reduce the high FODMAP foods. Then from weeks 8 to 12, you start reintroducing these foods. And then step 3, you're personalizing to work out which foods, you can eat, or if there's some that you need to leave out because they are your trigger foods. So Monash Uni has an app. It's not free. I bought it a few years ago. I think it was about $9. There are free apps, but if you are going to recommend the Monash University FODMAP diet, I'd be getting the proper app. I've got some of the free ones as well. I think this one's a lot easier to use. But you can clearly see here, we've got our FODMAP certified foods. And in step 1, when we are reducing the high FODMAP foods, you can use this app to check. So for example, here we can see avocado, and you might think, well, you think about FODMAPs, they're carbohydrates, tend not to think that avocado would be sort of high in these fermentable carbohydrates or sort of sugars. But actually avocado is quite high in sorbitol. So this is one that needs to be avoided in that initial phase. So here in step 2, so after that sort of 2 to 6 week period, when you're starting to reintroduce foods, the app can help you do that. So here we're looking at a pear, which has got fructose and sorbitol, and then the patient or the person can then put their symptoms down and find out if they're okay with tolerating that or they're not. And then step 3 is about personalizing their diet, working out what foods, or if it is a particular, is it one of those, FODMAPs, is there a particular type of food, type of carbohydrate they can't tolerate? Is it fructose? Is it mannitol? Is it sorbitol? So when it comes to the FODMAP diet, it is an elimination diet. And by taking away these FODMAP foods, you are taking away, possible fibers. And the first thing that you may think of, or, I initially thought of with the FODMAP diet is we need to put, prebiotics in. But the reality is these people tend to react very badly to prebiotics. So they will get bloating, they'll get pain, some cases maybe even nausea. So when it comes to adding in prebiotics, the prebiotic that has been certified or passed by the Monash Uni as a low FODMAP certified product is the partially hydrolyzed guar gum, PHGG, and the particular one that went through the testing with Monash is the sun fiber. So if you have attended past talks that we've done on metabolic health, or I've talked about fiber, so in the Philippines, data that I presented last year showed that most Filipinos were not reaching the RDI for fiber per day. There is the Pure Lean, which is one that I like by Pure Encapsulations, and that has the sun fiber in it. And I have shown that supplement before and talked about it because, fiber is obviously good for, regulating blood sugars, getting the bowels moving, cholesterol management, things like that. And we just want to have enough for a healthy gut, healthy bowel movement. But with the particular Pure product I'm talking about, it does have some other things in it. It's got a bit of magnesium, which should be fine, but also some other fibers. So if you are going to think about this particular one, just starting low and slow for those with gastrointestinal symptoms, because even though it's a very gentle fiber, there are some others in it, and these particular patients tend to be quite reactive to prebiotics. So being cautious with the prebiotics and the probiotics. So digestive enzymes can be really helpful for those that have, digestive issues that are, reacting to foods. And, we want to help patients with their symptoms. We have the ability with digestive enzymes, and there's lots of different varieties with Pure. But avoiding them in the challenge period. So if you are doing the autoimmune paleo diet, or you're doing an elimination diet from IFM or the FODMAP diet, when they're doing the reintroduction, you don't want them to have the digestive enzymes because you need to know if they are actually reacting to those foods. Another thing you may want to consider, just helping with sort of symptom management and reducing inflammation overall, is anti-inflammatory compounds. So thinking about things like omega-3s, turmeric, things like that. So when it comes to comparing diets, and if I just walk you through this here, so we can see up the top, we've got inflammation markers. So here we've got high sensitive CRP, interleukin-6. We've got, blood sugar measures, glucose, insulin, and then our lipids. So we've got total cholesterol, LDL, HDL, triglycerides, and our apolipoproteins. So then down on the vertical axis, we can see different diets, the Mediterranean diet, the DASH diet, which I haven't spoken about, but that's a really popular diet that, a lot of medical professionals give to reduce high blood pressure. There's actually very good evidence for the DASH diet reducing high blood pressure. Paleo, general dietary guidelines, plant-based, etc., going down to the Western diet. So the way that this table is comparing these factors such as inflammation, glycemic control, lipids, is that, I got scared with that little noise there. Someone needs to put their microphone on. I'll mute them. There we go. Can I mute? Yep. Asked to mute. So the way that this is laid out, the comparison they're doing is with this sucra value. So the higher the value, and if you look down here at the bottom, the sucra value ranges from 0 to 100%, and it's associated with each treatment connected network. A higher sucra indicates a greater chance the associated treatment is the best for achieving a favorable outcome. Basically, what it means is the higher the number, the better. So when it comes to the Mediterranean diet, we can actually see that the DASH diet or even the paleo diet, interestingly, even just normal general dietary guidelines, seem to be a bit better at reducing CRP than the Mediterranean diet from this study. When it comes to glucose, we can see that the Mediterranean diet performs better than the paleo diet. When we look at our, fats, we can see that For example, here, the Mediterranean diet, when it comes to reducing LDL, performs really the best there. So the important sort of, I guess, thing to note from this is that there is no one diet that hits everything, that's anti-inflammatory, that regulates your glucose, that, you know, helps balance your lipids, that gives particular outcomes, because we are all different. And food's important, but our genetics plays a role, our environment plays a role, our stress levels, thinking about glucose, you know, obviously if we're stressed, we're going to pump more glucose into the blood. So there, not only do we react differently to foods, there are other factors that will influence these metabolic markers as well. So this particular meta-analysis showed that the Mediterranean diet was likely the most effective in managing lipids, that a low-carb, high-fat diet may be better for glycemic control, and a paleo diet is likely the best for reducing inflammation. No dietary pattern performed consistently across all biomarkers or categories, although the paleo diet, DASH, and Mediterranean had the highest ratings. So when it comes to all of these different diets, the benefit is that we're actually, regardless of what diet, we're telling people to get rid of those ultra-processed foods. We're often removing trigger foods, so that's, you know, bringing that inflammation down, supporting their gut healing. It might improve nutrient intake in some foods if they start eating, you know, more healthy foods, whole foods, and they can be associated with improved cellular health, genetic and epigenetic function. The limitations are, though, that these may not suit cultural, social, or spiritual practices. So, you know, it'd be interesting to hear from you all at the end in the discussion time. You know, the Mediterranean diet is pushed, you know, as, you know, one of the best diets in relation to, you know, whether it be longevity or metabolic disorders. But the reality is that's, you know, different to the diet that you would have, you know, in China, in Hong Kong, in the Philippines. As I have, you know, tried to emphasize, and hopefully it's quite clear, the risk for nutrient deficiencies and insufficiencies can increase when people are restricted to a particular diet. Aside from maybe, you know, a paleo Mediterranean diet. And without guidance and support, eating disorders can emerge. And I didn't mention that. So not only have I had a number of patients come to me that haven't responded well to elimination diets, or have done the elimination diet, but then never done the reintroduction, and they've got themselves into, you know, not a good situation. They're limited with the foods they can have. They're scared to eat other food. There does become an obsession, and, you know, an eating disorder really comes about, and it affects, you know, every aspect of their life when they're scared to eat. Food sensitivities can also get worse after long-term elimination diets. So once those bacteria and those gut microbes, you know, die off, you know, they are involved in helping metabolize foods, you know, also making some nutrients and neurotransmitters. But as we sort of get this barren sort of, you know, gut microbiome, and then we don't have this sort of mucus, this nice layer to protect the gut, we can start to become, you know, more sensitive to foods, and it's harder to come back from that. So what do I recommend? I generally recommend a whole food diet. And I do have a whole food challenge that I do for 4 weeks. That's good for most people, not for everyone. In that I give lots of education around, you know, the different types of foods, but also chemicals, toxins, pesticides, and give some, you know, ideas on veggies, protein, carbs, and fat. But it's not meant to be really strict. And I talk about sort of 80-20, so that people can have, if they can tolerate it, if they're not dealing with a serious, you know, sensitivities, but they can have, you know, a glass of wine or chocolate here or there. But as long as they're eating well most of the time and they're getting all those nutrients in, there's the space to have some of these other foods that are really just associated with pleasure. I say that because they're not actually, you know, giving a lot of the nutrients. So when it comes to diet, 2017 meta-analysis that looked at 95 studies that were associated with 142 separate publications, it actually showed that 8 serves of veggies per day reduced all-cause mortality. And if everyone was to eat 8 serves of vegetables per day, it was predicted that this would prevent 7.8 million deaths globally, basically because this would then address the nutrient deficiency. So there are studies mainly in the US, but basically showing that, 90% of, US population have at least one, if not a handful of nutrient deficiencies. So in this particular case, it's actually looking at grams. So it's saying sort of 800 grams of fruits and vegetables. And if you do look at the study, there's tons and tons of, I've just pulled out one of the graphs. Vegetables is obviously one of the biggest predictors, but fruits do actually offer benefit as well. And I think in the health space, a lot of us tend to think, oh, fruits aren't so good, fructose, things like that. But the reality is when you look at the data, having fruit compared to not having fruit is generally associated with a lower risk of, cardiovascular disease, diabetes, cancers, things like that. I will just say, though, it's a lot of vegetables. And even though there's modeling and it seems to be that the more veggies we eat, people can be healthier, I have had a couple of patients, one in particular, I think her name popped up. I can't see now. Grace, if you're here, hopefully you're quite shy. I wouldn't even say you're one of my patients now. You're, like a colleague. She's a holistic dentist and been seeing me off and on for years. But she's someone who had an amazing diet, ate really well, and having smoothies in the morning with lots of green leafies and tons of veggies, a little bit of meat, and ended up having, high oxalates, some mild stuff, a few little rashes and things like that. And actually went to a carnivore diet for a short amount of time, and that improved things. I mean, she's not carnivore now, I don't think. You can let us know at the end if you are here, Grace. But yeah, just watching out for oxalates if you are having lots of these, particularly raw leafy greens or high oxalate foods, because they can aggravate you as well. So that particular study in 2017 suggested that we should be having, a lot of, fruits and veggies, up to 800 grams, which could potentially be about 8 serves. But this is a more recent study published in 2021, and it is looking at data from the Nurses' Health Study. Actually, if you look at it's got a much larger, the original cohort was much larger, but this is just looking at people that were followed and deaths documented. So there were over 66,000 women from the Nurses' Health, over 42,000 men from the Professionals Follow-Up Study, all free of, chronic conditions. They used a validated food frequency questionnaire at the start of the trial and then repeated this every 2 to 4 years throughout the 20-year period. And what they found is that fruits and vegetables, when it came to total mortality, I'm up here on the top left, total mortality, there was a decline in total mortality in those that had more fruits and vegetables. However, in this particular study, it seems to really plateau out at that 5 serves. And you can have a look at that too, and the paper if you want sort of more information. But what they found was that a higher intake of fruit and veggies is associated with lower mortality, as I said, and the risk reduction plateaued at about 5 serves of fruit and veggies a day. So most of the guidelines in the Philippines, in Australia, do talk about this 5 serves of, veggies, 2 serves of fruit. And I think that even though, we don't necessarily think about following the recommended dietary government guidelines, I do think that is quite sort of on point there. The other thing is we need to think about just being hydrated and having enough water. So many people are just not drinking enough water. It sounds so simple, but it affects, our appetite, it affects our sugar cravings, it affects our, fatigue levels, how well we perform. So having enough water. And then the other one to consider when we're thinking about, diets is meal timing and fasting. So we know that fasting can improve, lipids, insulin, immune function, hormone balance, and support weight loss. And when it comes to fasting, the reality is it can be quite difficult for some, even me included. I love food. I know that there are so many benefits with fasting. particularly around that healthy aging, which is, I really, really want to age well. I really want to reduce, Alzheimer's. I've got ApoE. But the thought of not eating for a day, it's difficult for me. But what tends to be better for most people is time-restricted eating. And this is a mouse model study. So not only do we have human studies showing that people are more compliant with time-restricted eating, but we have this particular study where they provided mice with a high-calorie fat diet. And what they showed is that when the mice had 24/7 access to this food, they became obese and they had metabolic disease. However, when they were only exposed to this food between a restricted feeding period, 9 to 10 hours, despite it being a high-fat diet, they were healthy, lean and fit. In addition, I won't go into it now, but there is a gene that I test for, clock. Clock is actually a transcription factor that affects lots of different genes involved in the circadian rhythm, so that day-night cycle, and it affects our hormones, leptin, ghrelin, things like that, and eating behavior. And people that have the clock gene, they tend to have a night, the SNP or the variation, they have a night preference. We call them night owls. They tend to want to work at night. They tend to be more likely to eat later at night. They don't sleep as well, and they're at risk for being more overweight, but they have weight loss resistance as well. So things like FTO, if you're familiar with some of the genetics, there are some genes that are linked with higher BMI, but studies show you can lose weight, with a high protein diet, things like that. But with the clock gene, it's a bit harder to lose weight. But in this case, they not only had a slow clock, which is what the SNP does, they did a knockout model and showed that despite not having that clock gene regulating circadian rhythm, the same thing, if these mice only ate within a 9 to 10 hour window, they still were healthy, lean and fit. So no surprise, I recommend to my clients, and I do time restricted eating, and I find that that's not too difficult, and most people can do that relatively easily. Often the studies are a 16-hour fast, 8-hour window to eat, but those studies are often in men, often in athletes. It doesn't sit so well, I think, with a lot of women, and people can binge eat, or they find it difficult. It causes them more stress. So I tend to say, 14-hour fast, eat within a 10-hour window, and that tends to be really achievable for most people and really good for just balancing blood sugars, sleeping better, etc. So as I mentioned, I have a whole food challenge. It's just 4 weeks. It's not that difficult. I guess it's a mini elimination diet in that I'm asking them to remove, packaged processed food and sugar. For 2 weeks, we trial going low dairy and, getting off gluten, because again, I work with a lot of people with autoimmune inflammatory stuff. People don't have to do that, but there's recommendations around trialing these things and bringing it back in. So just in 4 weeks of eating whole foods, the study, the challenge last year, we had 100% people say that completed the questionnaires before and at the end say they had more energy. 88% they had improved digestion. 87.5% said they'd lost weight. And on average, it was really only at 1 to 2 kilos, but we wouldn't want much more than that in 4 weeks. It's a pretty short challenge. 67% said they reduced symptoms. You would think this would be higher if they've got improved digestion, more energy, but the reality is my symptom tracker goes over lots of different things. So there are, and you probably have them as well. We often have them in that sort of functional medicine space where we're looking at, things around, cardiovascular stuff. So, heart rate and, mood, cognition, anxiety, lots of different areas, skin, hair, nails. Though, mind you, a lot of people do say that their skin is actually much better at the end of the 4 weeks. But with my symptom tracker, 67% said that there was a significant improvement in their symptoms, and just over 60% reduced their stress. So, we all know it, where we practice food is medicine, but just showing that in 4 weeks, people can have such a big difference when they really do commit to healthy eating. So in summary, nutrient intake is the cornerstone to long-term health and wellness. Choosing the right diet depends on various factors, including cultural, social, seasonal availability of foods, taste preferences, activity levels, and health goals. So if we are thinking about someone who just wants to, improve their health, it may be just saying, thinking about a whole food diet or, eating more real foods, reducing sugar. But if they are focused on a particular, for example, there is seizures, which is obviously a very small part of this population, then maybe it would be a ketogenic diet. But different diets provide different amounts of macro and micronutrients that may not meet the recommended dietary intake. And that is one of the things that I really wanted to get across today, is that even though there are lots of diets to choose from, it's hard to know which one. The reality is when we do start doing diets and restricting food groups, there is a big chance that there is going to be nutrient deficiencies, and that's the last thing we want to do as practitioners. So those with gastrointestinal symptoms may benefit from anti-inflammatory compounds. I mentioned before, omega-3s, turmeric, things like that, and digestive enzymes alongside their dietary recommendations. And remember, if we're giving the digestive enzymes, stop them in the challenge period or when they're reintroducing food so they can really assess how the foods are affecting them. Consider time-restricted eating practices, which is really good for metabolic health. Monitor hydration. By the way, maybe next year or in 6 months' time, I'll be telling you about, having full days of fasting. I'm aiming for that. I'm not there yet. Monitor hydration and aim for real food that is nutrient dense, and just overall avoiding inflammatory food.